Good. Thanks, Haley. Good morning. I am Lindsay Denny, coming to you all from Washington, D.C. I am the Health Advisor for Global Water 2020. We're a WASH initiative looking at underrepresented issues in the WASH space, specifically WASH and healthcare facilities is one of our key issues. So excited to have this conversation. As I mentioned before, this is meant to be an informal discussion. I feel like I'm missing out on these conversations that we usually have at conferences and events. So we'll keep the presenting to a minimum here. Again, feel free to turn on your video if you want. Say hello to everyone. Thanks, Paul, for doing it. So today we are here to talk about cleaners. I'm really excited so many of you are interested in cleaners. We'll later get to hear from Wendy Graham, the patron saint of cleaners. So we're very excited. Today is Thank Your Cleaner Day, which we happened to come across. It is Kärcher is the name of the company that has turned this day into a celebration of cleaners. And we are specifically focusing on cleaners in healthcare facilities. So we have a fun conversation today. We have a bit of agenda, so to let you know, we'll discuss cleaners and cleanliness and environment, why they're so important, and then in particular, we, with the help of input from many of you on the call, came up with a list of 12 recommendations of how you involve cleaners in your work. So Haley, who's been spearheading that work at Global Water 2020, will go through that. And then I had called upon a few people who've been doing work with cleaners to speak about their work. So we have, first of all, we're going to hear ideally from a cleaning company in Malawi. Hopefully they'll be able to join us with their connectivity. And then a couple organizations who will say a few words about their work with cleaners, how they've been doing it, challenges, opportunities, anything like that. And then I'd like to open the floor to all of you. If you have experiences, things that have worked well for you, questions you'd like to ask. Again, this is meant to be a dialogue and a discussion. And for those just joining, feel free to turn on your video. Don't be shy. We'd love to see everyone's faces this morning. Thank you, Agatha, that's great. So first off, I will hand over to Haley to give us a little intro, and then we'll get the show on the road. Thanks, Haley.
Thanks, Lindsay. Hi, everyone, and thank you all for joining today. I'm very excited for what we're going to have, so thanks, everyone, for being here. Like Lindsay said, here at Global Water 2020, we came up with a guidance note that I think we shared with you before the event, but if not, we'll share with you during the event, or we'll just post it in the chat box. But we came up with this document mainly to try to brainstorm ways that cleaners can be more engaged within the conversation and how we can elevate their role and highlight more so the human element of cleaning as compared to the action itself within healthcare facilities. So we all know why safe healthcare environments are important. We all know that we want healthcare facilities to be areas of safety and good health rather than infection. So with this document, we highlighted and came up with 12 recommendations, as Lindsay said. And they range from smaller to larger recommendations, but they're meant to be for individuals, organizations, implementers, and donors alike to really engage with cleaners and to incorporate them into their work. So moving forward, I'm just going to list the 12 actions that we have. I'm not really going to go into them because they're kind of long and lengthy, and I would rather hear from the other speakers. So what we came up with was the 12 that we include training or organizing both orientation and refresher trainings for cleaners, implementing or creating supplies and facilities. So in doing that, it would be solidifying supply chains, resources, making PPE and personal protective equipment available for cleaners, basically the materials that they need to clean within healthcare facilities, so mops, buckets, soap, things like that. Hand washing. Ensuring that cleaners have the access not only to hand washing facilities, but also, with tap.
Hello.
Hi.
Is it possible to speak a little bit slower?
Oh, yes, I will speak slower.
Okay.
Yep. And so the next one that we came up with was job descriptions. Oftentimes in healthcare facilities, cleaners don't have a specific job description or appropriate contract within healthcare facilities. So providing that for them would be able to incorporate them more into the healthcare facility environment. Additionally, advocate for more budgets to include salaries for cleaners, as well as more supplies and PPE. So if we can budget that at the facility level, that would be a recommendation we would say. Additionally, providing policies and protocols. So more encouraging and supporting with the Ministry of Health to develop policies and protocols within the healthcare facility. Additionally, auditing and monitoring. So conducting audits for the current inventory, and then with monitoring, implementing routine monitoring of cleaning practices. And again, I'm kind of ripping through these, but you'll get this document later. We'll put it in the chat box. And then the last three include hygiene and safety culture. So really trying to promote a culture of safety and hygiene within the facility, and emphasizing that cleaners are kind of the frontline workers at this event, and promoting and creating safety within the healthcare facility. Providing performance-based incentives. So this is something that I really agree with, but recommending the introduction of incentives for cleaners based on their work performance. So I'm sure most of you have heard of the Clean Clinic approach, other things like that, really to engage and bring cleaners to the table and have them recognize that their work is important. Thank you, Lindsay. And then lastly, committee involvement. So encouraging healthcare facility management staff to take input from cleaners by involving them in IPC committees. So that is the 12 that we recommended. And Lindsay, I'll give it back to you, and we will share this document. I think it's in the chat box now. Thanks.
Yeah, great. Thank you, Haley. So as Haley said, we pulled this together with feedback from a number of experts in this space, and in particular, looked at existing documents. In this guidance document, what you'll find in addition to these recommendations, whether you're an implementer, a donor, an advocate, or an actual someone running a healthcare facility, administrator, there's also resources at the end of this regarding environmental cleaning. Though I would note that many of these don't necessarily focus on the person, they focus on the action. And so again, today we want to talk about the people who undertake the cleaning. But for example, this report or best practice document from CDC is a fantastic example of some of the best practices that have been pulled together over the years that may be useful for everyone's work. So I put that in the chat box. If you haven't had a chance to take a look, I highly encourage it. But we really want to hear from what you all are doing. So first and foremost, I will hand over the microphone to Agatha. Agatha, I believe you are you with the colleagues within the hospital for cleaning?
Yes, so with me I have Mary Kabiwa, who is the Chief Nursing Officer here, and I have one of our senior cleaners, Joyce Muhone, so she can also share her experiences and the challenges. And I have three from the hospital cleaning services. So I think you have been communicating with Elsie, so she's here with the other two colleagues. So she can introduce their names.
Fantastic. Well, I will hand it over to you all to speak about cleaning in the hospitals in Malawi, about your experiences. And if you guys, you don't have to, but we can only see the top of your head. So if you want to tip down your screen, we'd love to see your faces.
Thank you very much. My name is Managing Director of this Abyss Investments. We are doing cleaning services at Kärcher Central Hospital here.
One of the cleaners who is cleaning the hospital cases. Our first and ex-supervisor cleaning Abyss.
Welcome you all, thank you.
Yes, so where do we start? So should they share their own experiences?
Yes,
we start with the hospital or we start with UNC?
You all can start, whoever you'd like to start with.
So we can start with the hospital. So I think there are some three questions whereby they would want to know your job description, the challenges, and some of the challenges related to COVID-19 pandemic. Yeah.
Thank you very much. We feel greatly privileged for this opportunity that we can present for the team elevating the role of cleaners. Mainly my presentation this afternoon will be centered on three key points, like the roles and the responsibilities of cleaners in the healthcare, successful aspects of cleaners' job and challenges, and the effect of COVID-19 on a cleaning job. I'll start with the roles and the responsibilities. As cleaners, we provide cleaning environment at the hospital. This is to ensure that the environment is clean and keep free from bacterial breeding grounds. And this includes the cleaning of floors, cleaning windows, walls, sinks, toilets, and the bathrooms. Generally keeping the rooms and the patient's wards clean at all times to make the rooms habitable. And secondly, we provide health environment. How? This involves the disinfecting surfaces using recommended chemicals like chlorine, Precept, Dettol, and sanitizers. In the process, we are trying to, in this process, we are trying to kill harmful bacteria and viruses and keeping hospital environment clean and healthy. The other responsibility is preventing the spread of infection. This is disinfecting the frequently touched surfaces from time to time. That is toilet seats, taps, electrical switches, and handrails. Sanitation is another responsibility that we provide. Sanitation, that is the removing and emptying of refuse bins from the wards and what have you. Then waste disposal. That is separating waste from proper disposal. That is fluid, plastics, and papers. Generally, our roles and responsibility are summed up to creating a healing environment. Now, on the successful aspects of cleaners' job is consistency, because we need to be consistent with the job that we are doing, the cleaning that we are providing in the hospital. We need to be consistent because we have our way of cleaning the place, and the people are patting our backs because of how we clean the hospital. And then we need to be consistent. That is why we encourage, we do training, we do trainings time and again, so that our children, so that our workers should not slack down with their jobs. They should keep up the standard that we recommend as a company. The other one is attentiveness to details. We recommend that our cleaners should have an eye where they can spot dirt and do the cleaning right away. The other one is honesty. Our junior staff are trained to be honest with hospital property at all times. On that one, lastly, is timekeeping. We recommend that they keep time always to pave way for doctors and even the other people to come and visit, maybe the patients. On the challenges, we meet challenges, of course, with the cleaning disorganized places, like emergency rooms where there's blood all over. You see people coming in with patients who are involved in accidents. So we need to train our children. I mean, sorry, I keep saying that. I don't know why. We need to train our workers to how to handle that and disinfect the places as soon as possible, so that they can we should avoid the spread of diseases through that. And the other one is cleaning heavy traffic in places. We are okay this time around because the people are not like flowing in the wards. They are not flocking in the wards. But in the past, we used to have more problems because we could see people walking around. So we had difficulties because we had to clean the place time and again to make it look clean. Working at heights, sometimes we are required to climb up so as to remove the dirt and the cobwebs upstairs. So those are the challenges also, because sometimes if we can, our workers can be involved in emergencies like falling down. But we thank heavens that that has not happened, because we train them how to take care of themselves when they are working in those places. Yeah, lastly on that one, on challenges, the sharp objects, disposing off of sharp objects like syringes and sometimes maybe razor blades. Those are the challenges that we meet. Sometimes they can get pricked with the needles, and you don't know who they have used with that with those needles. So those are our challenges. Now to come on the last point on COVID-19 effects. That one has hit us a big time, in the sense that on the expenses, we see the rise in demand for the PPEs, resulting into rise in cost of purchasing PPEs. Extra training was needed because we had to hire people from outside to train our workers how to conduct themselves during this COVID-19 and how to properly wear their PPEs. That is including wearing the right uniform, what else? The masks, and what the aprons, hand gloves, and what have you. So these are to be used properly. You know, we were not used to walking around and working whilst we have masks on. This has just come, so it's something that is new. But then we are coping because we have to monitor the workers to make sure they are using the PPEs, and they give us feedback that we are managing on that one. And the other one is waste management has stepped up to reduce the spread of COVID-19. Now, in conclusion, this COVID-19 has affected the cleaning industry financially. You know, we have to buy the stuff and later on the gown, which is not easy. It's costly. So thank you very much. Those are my remarks on that one. Thank you.
Thank you so much. That's really insightful. Is there others from your team who'd like to give a word?
As a junior, who is currently working on the place where my chances are high of contracting this pandemic, which is called COVID-19. Yeah, my life was on risk since I am the first person to touch each and everywhere where people had to go so that I may clean the area has to look makeuply. So being a worker, I'm working on a place whereby, I mean, the spread of the disease is almost high. So I had those chances of contracting the disease. So that also affected my life as well, because I had to work, but with some fear, so that maybe I should protect myself from the pandemic. As we know, this one is not all that easy. So that also contributed some effects to my job, because I had no choice, but I have to do it because it is my job to make things work at the hospital. Yeah, as for the other things, I think it's my duty and the way I was trained. I need to make the rooms, the toilet. I mean, it's my responsibility to make the hospital look nicely. So how much as I've been provided by the tools, the chemicals that are recommended by the hospital, I have to do my job so that my boss and even the patient themselves, the visitors, are moving in the right way. I mean, their lives are safe with me because I took risk with them. So that was my duty as well. So as for me as a junior, I cannot say much. This is all I can say. As a cleaner, who is responsible for the cleanliness of the hospital? So these are the things that so far I can just highlight on the subject. Thank you.
Well, naturally, thank you. And today is about you. So thank you for your dedication and your commitment to cleaning the hospital, ensuring that every patient has a safe experience and every healthcare worker is safe in doing their job. We appreciate everything you do. And I also wonder if there are 30 people on this call. If Zaira, is there anything that you wish people knew about your work or we could do more of to make your job safer and better?
Is it for me?
For Zaira, or either of you, is there anything that you all are the experts in cleaning, this is what you do every day. Are there things that we all could be doing to help make your job easier, better, more efficient, or safer?
All right, now just put our logo somewhere so that we're able to be known by some of the countries that there are people here who are working night and day so that
We can't fully hear you. Could you turn the phone towards you and then say that again? I'm sorry. Thank you.
all right.
Perfect.
All I'm saying is, I'm getting you. All I'm saying is, maybe it's just a litmus that maybe this logo of ours, you see this logo, this one. You see this logo? Yeah, maybe you can put it somewhere so that there are some people who care for other people's lives. This company is doing a lot somewhere else in Malawi. When you need it, just let us know. We're there everywhere in the world. We'll be there. We'll do the cleaning. We'll do whatever. So that's what I can request.
To add on that one, sorry, I think we lack sometimes the equipment to scrap the floors, because the floors has to be scrubbed most of the times. We do that, maybe we're supposed to do that twice a week, scrubbing the floors. So we lack the equipment, like the scrubbing machines and some equipment, and including the protective gowns. We do not have those. Our workers they do not have those. They do not have access to that. Yeah. Thank you.
We have a supervisor also here. Maybe okay. He's saying that doesn't have anything to say.
Thank you, Agatha, for organizing this. So we've heard from the cleaning company, as well as the cleaner in Malawi, as well as Agatha, who's organized this, the chief of nursing. We really appreciate all of your insights. And if you're able to stay on the call, we'd love to have you as we talk about some of the work that people are doing to reach cleaners.
Should we allow the cleaner for UNC project to share her own experiences?
Sure, we have a minute if you'd like to. Yeah.
My name is Joyce Muhone. I've been working with the UNC for 19 years. Early in the morning, as soon we reach our offices, we open our rooms. After opening our rooms, we are starting cleaning the rooms. Before we start the cleaning of the room, we start dusting. After dusting is when we started the cleaning of the rooms. After cleaning, we arrange in order everything to make sure that room, when our clinic staff is coming, they are coming in the room, they should find everything is mine. Since here at UNC project, we are doing the research things. So things for cleaning is not a big problem because they give us everything for doing our job and to look our rooms to be clean. After cleaning the rooms, we allow our clients to enter inside our building. So we sensitize them about our building, make sure that they have to know that our toilet, how to use. As you know, that here in our country, most of our people, they are using the P13. So we're trying to teach them how to handle our toilets here. When the nurses and the doctors are in, we allow them to meet with them. As soon as they are doing their activities, the office at our UNC project, because these people, they stay alone, we used to give them some drinks and some snacks. Another thing which we are doing there, and despite of looking at the clients, we are transporting the specimen from the other lab to the other lab to another lab. In fact, inside the building, we have got the main lab and we have got the pathology lab. Since we have got so many studies which are doing, the others is the lab is outside. In other time, if they have seen our client, maybe they become sick, they allow us to take the clients to escort them to KSH for some x-rays and further management. If they found that our client is very sick, the needs for admission, we go there and make sure that the things done well and they provided, arrange for everything there. That's all for the cleaning. And sometimes we attend the meetings with our fellow friends to remind you whatever we are doing in that clinic. The challenges we all come early in the morning if there is where we are staying is far away. We have a lot of rooms to clean for a short period or for a short time. So we have to start early in the morning. Sometimes we fail to come early in the morning. We are able to finish our room to clean all the rooms. During this COVID, we used to screen people, whoever is entering the rooms. It was very difficult to us because we clean, then after that, we have to screen the rooms. We have to clean the rooms. Sometimes when starting cleaning, our nurses and our doctors, they just put the papers, some all over in the room. So when coming in the morning, we have to arrange all the papers and all the whatever is there. And we must have to empty the bins and putting all arranging in the rooms. That's all.
Thank you so much. And
Yeah, just one.
yes?
Clinic aid who works with you, they have missed. These clinic aides, when they are recruited, they are trained, just as our friend has been saying that they train them so that they know about caring themselves, prevention of infections. So once a year, they also do the infection prevention training. So apart from cleaning, they are involved in health education because, as she has rightly said, when people come inside, they are coming from villages. They don't know how to use our toilets and whatsoever. So these are the clinics because they are the first people who meet our participants. They come very early in the morning. So they are also trained with that one, how to handle our participants. And she also talked about giving them drinks and snacks. You know, with research, there are a lot of rumors, misconceptions outside. You give snacks and people may misinterpret. Why are you giving snacks and drinks? So the clinics, they also are taught to say these snacks are just for them because they've been there for in the morning. They need something at least like buy. Nothing to do with the selling of blood, whatsoever, as the rumors sometimes will come. So we rely on our clinics, but we feel bad for them because, as she has rightly said, these are people who wake up in the morning and their villages are very far. It's risky for them, but they are supposed to be here before the staff or the participants arrive. So they manage those things. Again, when we knock off in the evening, they're the last people because they have to do the closing of the doors, they're making sure that things are switched off. Sometimes as staff members, we forget to do those things, but clinics, they manage those things just very nicely. Yeah, so we have a lot of things that our clinics do. Apart from what she has said, sometimes, you know, as the staff members, at UNC, we really follow up the 3 bin system in the clinics, but the human beings, sometimes they can misbehave. Sometimes they throw, instead of using the sharp containers for whatever reason, maybe they throw. So they are exposed to such things. But normally, because of the training that we do to them, empowering them that once they see those things are done, they should be able to report immediately so that we take actions. Yeah, so most of the things are what the hospital staff are doing or whatever also our staff at UNC is doing, apart from them being empowered to sensitize our participants and teach our participants, like these days of the COVID, they are so much involved in screening participants, checking their temperatures. So some participants come very early before staff come in, but the clinics are the ones who manage those things. They are doing a very, very good job for us to manage, to have a good environment. It's because of these clinics. Yeah, as far as the equipment is concerned with UNC, it's not much of a challenge because as a research, you cannot be approved if you are below standards. Yeah, thank you.
Yeah, so just to summarize a bit on what has been said, you can see that what the hospital, the cleaning done in the hospital is more or less similar to what is being done here at UNC project, and the challenges are more or less the same. At some point, the cleaners here at UNC, they are involved in some work at the hospital because we have some studies which are being done at the hospital. So at some point, they have to work hand in hand with the cleaners, the other cleaning services, because they need to know where they can clean and where they cannot clean, what solutions are using and what we are using. So we try as much as possible to make sure that they work as a team. Otherwise, we end up having problems because the cleaner for UNC cannot do everything at the ward. They also rely on the company to help us whenever there's need. So that's what I wanted to add.
Thank you all so much. That was so enlightening and really helpful to hear, particularly in the age of COVID, when we know cleaners are, who are already important, are one of the most important members of the staff. So it's great to hear what the hospital and the UNC team are doing to ensure that cleaners are trained and prepared and the sorts of jobs that you all are doing. So I want to then transition over to Dr. Wendy Graham, who has been training cleaners for years now and has worked previously with Soapbox Collaborative. And then we have a few other colleagues from different organizations we'll hear from. So if you all could have some brief remarks about your work with cleaners, we'd love to hear from you. Wendy?
Okay, thank you very much, Lindsay. Can you hear me okay? Yeah, very good. Thank you. I'm delighted to join you on this first International Day to thank your cleaner. I thought for a long while there should be a Hug Your Cleaner Day, but obviously with COVID-19 we shouldn't be hugging anybody, but this is a very good substitute, Thank Your Cleaner Day. And this is coming just after the first International Day for the Clean Hospitals Day as well. So there's a lot of attention about cleaning at the moment, and I'm really delighted. I guess I've worked on cleaning for about the last 8 years, and I guess it's a sort of strange choice for a professor of obstetrics and epidemiology. But it's very logical in lots of ways because it's an integral part of quality of care. Cleaning is essential to issues of essential part of infection prevention and control. It relates to WASH. It relates to topical subjects of antimicrobial resistance and healthcare associated infections. So cleaning is at the center of many other topical areas, and I think it's really important to join up those connections. So in my few minutes, and I'm conscious of the time, I was going to talk a little bit about the work of Soapbox and in particular the Teach Clean package, but that is listed on the resources, so I'm going to not talk about that, but just talk about 3 key messages. And these, I hope, it was fantastic to hear the experiences from Kamuzu Hospital. So I'm just going to share my screen, and I have 1 slide. It's a rather busy slide, but if we run out of time, the slide, if you can enable me to...
Just did.
Yeah, okay. I'll share my screen. And what you should be seeing, I hope, is a picture, a very clean looking situation. And my first message is about, just as was echoed in the final words of the presentations from Kamuzu, was COVID-19 has basically turned the world upside down, people's lives, their well-being, their jobs, and cleaning very much, and the whole act of cleaning and those who do cleaning, many things have changed. So this particular picture I took yesterday. So one of the things that has happened to me is that I've gone back into clinical work. I'm not able to travel to the countries where I feel most at home, working with the hospitals. So I've gone back to clinical work. And this is a picture of a room after what has happened with Deep Clean. And with a dedicated team, I realize this is a very different context from certainly what I've been used to, but this is where I'm practicing now. It's where Deep Clean and the procedures of cleaning have shifted as a consequence of COVID-19. And this particular hospital, pretty much everyone cleans now. So I see doctors cleaning surfaces in the patient zone. The nurses are continuously cleaning surfaces as well. The kitchen staff are paying greater attention to cleaning. And of course, those staff dedicated to cleaning, they're doing intensive work, just as was described for Kamuzu. And they also have some new responsibilities around extra precautions when they're working very closely with COVID patients. And this particular ward that I'm working on, it has COVID-19 patients. So what has happened is we've created this culture of heightened attention to cleaning. It's what you might call a cleaning fest. But my question is, can we build on this? Is this extra attention that we're receiving now, which in some ways is greater advocacy for the role and the importance of cleaning than anything we've seen before? Oddly, this pandemic has advocated for greater attention to cleaning, but we must make sure this doesn't slip from view. So that's my first point. We must build on this and make sure we don't go back to cleaning and cleaners disappearing from view when we have come out of, when we're in a post-COVID world. Although some of us find that hard to imagine at the moment, particularly from working clinically. My second issue is about the rights of cleaners. And just one graph, a rather clumsy graph as it were, but this is COVID-19 has also shone lights on issues of infection relative to jobs. And this particular chart, and you can follow up with it with the link at the bottom, it shows you along the bottom, the horizontal axis, the average weekly pay, and up the vertical axis, it's a risk index, and in particular, occupational risk of infection. And this is data from the UK, but there are data from other countries as well. And although they did not have a particular bubble for cleaners in hospitals or cleaners in healthcare facilities, if you look at the combination of nursing auxiliaries, many of whom do a lot of cleaning, you can see that they have a low average wage and a very high infection or occupational risk. And the same with cleaners in a domestic environment, low wages and a non-trivial risk. And what I think this means is we have to recognize that cleaners in healthcare facilities, they are facing high risks of infection and enduring low wages. And we need to promote the rights of cleaners. Those rights include access to good job descriptions, the right to a decent pay, the right to PPE and personal protection for the very dangerous jobs that they're carrying out. And what that is really important that we enable cleaners to carry out their role very clearly. So my final point, and then I really will stop, and that goes back to this issue of what cleaners need to be able to carry out their job effectively. I feel like at the beginning of my work, it was interesting that the WASH environment, the WASH community and the WASH actors really embraced this attention extra right back over 8 years ago. The WASH community really embraced the issue of the importance of cleaning and how for example, the joint monitoring program, it picked up on indicators that could be used to monitor cleaning. And there was less attention from the sort of IPC side because it was sort of assumed that cleaning is obvious, it's a core component. What I see now in this sort of context of COVID-19 is that a lot of attention around cleaning in the context of broader IPC. But we mustn't forget the importance of strengthening WASH in healthcare facilities as well. I mean, let's just take the basic issue of the need for water. Water, we have over a quarter of facilities do not have basic water supplies, reliable water supplies, and water is essential for many, many things. Hand hygiene, of course, but also crucially, cleaners can't do their job. We can't, no amount of hand gel can cope with what we need for cleaning. People talk about hand hygiene being practiced by use of hand gel, but actually for cleaning, we need water. So we want to make sure that cleaning is something that's relevant to many topics. We must make sure that it helps us join up both WASH and IPC. It's an issue for both. If I stop showing my screen for a minute, you'll have seen perhaps in the picture behind me, this is a picture taken from a group of cleaners that I've worked with in the Gambia in particular. I think it really is time. Let's seize the moment that COVID-19 provides to us to make sure it doesn't fall off the agenda, that we think about the rights of cleaners. They face significant occupational risk. And let's make sure that the WASH aspects and the IPC aspects as they relate to cleaning really remain joined up. And we don't see this as purely a training issue, it's also an infrastructure issue as well. And thank you very much for giving me this opportunity to speak about a subject very dear to my heart. Thank you.
Professor Mop and Bucket, thank you, Wendy. And for those of you who have not had a chance to look at the Teach Clean program, I highly recommend it. There are videos online to describe it. The tool is in the resource. And I believe, Wendy, you can contact London School, is that right, to get a full copy of the training?
Yes, yes, it's completely available. We've also done some more work on illustrated guidelines, and we're working with WaterAid Cambodia to think about a digital version to cope with training that doesn't involve face-to-face workshops. But I gave my email. You can download the work of what was the Soapbox Collaborative carries on at the London School of Hygiene and Tropical Medicine. So do contact me there.
Oh, and that's very full circle because I helped train cleaners in Cambodia with WaterAid like 4 years ago. So I'm glad to see that's continuing. Thank you, Wendy. Next, we have Lauren Alcorn from OneDrop. Lauren, I would love to hear your work on cleaners.
Great, thank you, Lindsay. And actually, it's a great segue from Dr. Wendy Graham because OneDrop Foundation is a WASH organization. And when the resolution for WASH and healthcare facilities was put forth, we were very quick to sign on. OneDrop being a WASH organization where we work with some of the most vulnerable populations around the world to bring access to water, sanitation, and hygiene. And in fact, we do this not just as a donor, but through technical assistance, because we strongly believe in behavior change and the need for behavior change. Infrastructure alone will not solve these problems and issues. We really have to address the behaviors, the barriers that are hinged to it, along with the barriers of capital as well. So we have been working in healthcare facilities a little more informally over the previous years, and then more so in the last few years formally, where we have 4 core projects that are in WASH and healthcare facilities. So when Global Water 2020 put together this fabulous list and wanted to bring recognition to the cleaners, we have an internal task force of our project managers and our behavior change specialists, social art for behavior change specifically. And we brought our heads together to think about this importance of cleaners and what does this look like in the projects that we're supporting. So we have 4 projects that we support. We work in Haiti, Malawi, Mali, and Burkina Faso. And we kind of did this exercise where we took the 12 actions that the proposed actions, and we looked at them from the lens of the projects that we're supporting and the kind of work that's happening or not happening and the recommendations going forward. So recognizing that we're short of time here, I had gone through and put together these different threads and where things are linking. So I'm going to try and just highlight a few core points around training. Wendy, you spoke about how the importance of IPC and WASH coming together. And in fact, we are seeing that now more so now that we're speaking of WASH and healthcare facility as a momentum. The trainings are combined. Thank goodness for that, because for all of us, for all of you who undergo these trainings, I can't imagine going through the amount of hours of training on IPC and then having, you know, the WASH infrastructure come in and then going back and going through a whole other subset of trainings on the WASH infrastructure alone. They really need to be combined because we understand that the roles and responsibilities should be linked to that as well. However, one thing we did notice and an observation that we made is, you know, in project implementation plans or annual work plans, we see that these trainings are for healthcare facility staff. It's a very blanket description, but when you break that down, that's everybody from a supervisor to the cleaners to everybody in between. And it's really important to recognize that these trainings may not necessarily be one training for all healthcare facility staff. It can't necessarily be blanketed, and it has to be kind of segmented out, recognizing there's different levels, different roles and responsibilities to really ensure what we're trying to work for is a healthy and safety working environment. The recommendation about supplies and facilities we found was also quite interesting, recognizing that facilities, when we speak about this, and I'm speaking about this from a WASH lens more so, that typically comes from donors, right? Like ourselves, One Drop, where we support the new construction or rehabilitation of these facilities. And I'm speaking only to those that that cleaners typically deal with. So we're talking about waste management and environmental cleaning, such as that is described in the WASH Fit JMP. But additional needs of cleaners such as like laundry pads, designated drying areas, hand washing stations. This typically, like I said, comes from a lot of donor funding. But then where you have reoccurring costs, such as, you know, cleaning supplies, that's typically budgeted within the healthcare facility or at district levels. So there's a bit of a separation there. The one thing we wanted to note, though, was where and I'm going to bring this to the second question that I was supposed to address, is how do we make this easier? We just need to recognize that in the design of these facilities and this technology or infrastructure. So as simple as something like mop and bucket sinks, we have to design this for the user, right? So it's not to have a sink that's at waist height, it's to have it on the floor. This is where you can easily fill and empty the buckets, have an extension tube, this kind of thinking. So designing with the user, for the user, is really, really important. And sometimes we forget this. What else? Job descriptions, we spoke about that. We had some interesting reflections on that. I'm not going to go into it as much, but yes, very much the need. I think there is, in some cases, we even see that this role has become dismissed or even informal, and the job descriptions don't even exist. And there's a huge risk for that, the right of the cleaner, the right of the worker. So not only just to have good, strong job descriptions, but to advocate for them as well. I'm going to speak about the hygiene, safety, and culture. So that was action number 10. This generated a lot of discussion within our group. So we see with the COVID-19 pandemic that certainly this has raised the need and for hygiene and safety that benefits all. The work that we do at One Drop, I spoke about not just our role as a donor, but our technical assistance in our what we call social art for behavior change. So it's a behavior change approach that is done in a participatory and artistic way. And to give you some examples, we really are trying to address this kind of culture of hygiene and safety through some of these activities. So for example, in Haiti, we identified actually that the priority groups are exactly the cleaners. So we've been working with the cleaners, designing activities on mural painting and song creation workshops that are created with the cleaners. And this is giving them not only a voice, but a space to elevate their importance in the healthcare facility setting. And in Malawi, we are working with a comedy sketch group to workshop with cleaners and facility users. This is more around the behavior of latrine usage. This is so working with comedy helps evoke emotional response through laughter and play, and the messaging is more around the importance of clean latrines. The formative research actually tells us that, you know, if you have dirty latrines, this is a barrier and people won't use them. So then unhealthy practices such as open defecation continue. So we've been focusing on that this responsibility of a clean latrine is not just that of, shouldn't just fall to the cleaner, but also to the users as well. And we do this, like I said, through a fun and playful comedic way. Because sometimes talking about poo just has to be funny. Lastly, one of the things that we are working with that I just want to mention is very cross-cutting, and Haley spoke to it as well, is results-based financing. This is we're trying this approach in Haiti with our project there, and it's interesting because it touches on so many of these actions that you've listed. So it speaks to strengthening of the supply chain, addresses budgeting, monitoring based on the WASH fit indicators, and addresses also performance incentives. So be interested if anybody else has any other models of that we'd like to hear from. And I'll stop there.
Thanks so much, Lauren. And specifically thinking about designing with the user in mind, I think we often think about the healthcare worker, which is certainly important, but how often do we think about the needs of the cleaner in the healthcare facility? So thank you. I'm going to hand off now to Francois Kangela of CRS. Francois, are you with us? Hi, Francois.
Yeah, hi everyone. Thank you, Lindsay, for having me here. So I would like to share with you shortly some achievement of CRS in the field. So in the past 2 years, CRS has been working in 5 countries in Africa. Among them, we have Burkina Faso, Ethiopia, Madagascar, Ghana, and the Democratic Republic of Congo. So for promoting the WASH in healthcare facility. So in the core strategies asset of CRS, we also took the for elevating the role of the cleaning staff. So in the past 2 years, we have trained 34 cleaners in Burkina Faso, 30 cleaners in Ethiopia, 16 in Madagascar, and 20 in DR Congo. So despite this effort, the role of cleaners remains marginal. And to now, we are hard working with all stakeholders, especially the government officials, to strengthen the and formalize the supervision of cleaners, the monitoring, performance monitoring of those cleaners, to define their job descriptions. And also we are making an emphasis on how to hold health facility managers responsible for elevating this role of cleaners. So this is why now I would like to thank Lizzie, who is really taking a leading role in this area, and also Wendy for developing Teach Clean package. So we are also piloting Teach Clean package in DRC and Madagascar. Also, I thank Global 2020 for developing this guidance note that we will be using already for the next training for health facility managers. Now, the key message I would like to share with you is the advocacy activities. If we look this guidance note, we need to work with high-level decision makers in this, mostly in the limited low and middle income countries. The political leaders, the government officials should really get involved in this work to elevate the role of cleaners in hospitals and primary healthcare. So, over for me.
Thank you, Francois. And I think that's a great point here on advocacy. And I'd also like to point out that organizations who don't necessarily consider themselves advocates. Now, CRS is not necessarily an advocacy organization, but you all are doing advocacy. And so to the point that everyone has a role to play, everyone can speak forward. So thank you, Francois. Last but not least, of course, I have Prakash Bahura from Terezom in Nepal. And I apologize, Prakash, I know it is evening your time, but we would love to hear a few words about the work you are doing.
Thank you, Lindsay, and Global Water 2020 team for your great work for promoting washing healthcare facility. It's a great opportunity for me as well. Hi, this is Prakash, and I work for TDH Nepal, and I'm responsible for wash and health program in Nepal delegation. As for TDH, TDH is Swiss-based NGO, and we have been implementing wash in healthcare facility project in Nepal for quite a long time, where we have been supporting health system for ensuring basic wash services in place in healthcare facility setting, including infection prevention and control, basically to provide dignified services to the communities, particularly to the women. Besides that, we do wash intervention in school and as well as in the community. So on this very important and dedicated day to the cleaner, it is wise to highlight some of our work targeted to the cleaner and the experience gained by TDS while working in healthcare facility setting. So I believe that it could be useful to others as well who are working in this sector in washing, who has been promoting washing healthcare facility. So basically, our main intervention with the cleaner includes basically capacity building training on infection prevention control and healthcare waste management, and supply of cleaning material, which include like PPEs, other items for the cleaner, and advocacy with the municipality and health management committee for creating an enabling environment for the cleaner. So here I also like we basically focus on the advocacy activity as well. The target of our advocacy activities is to make everyone realize about the importance of the role of a cleaner in healthcare facility, for good health of health worker as well as community, and also realize them about the work they have been doing against their capacity and resources injected to them, like within the limited resources, how they are working, like in the healthcare facility setting. And in addition to that, we are also rolling out Wash Fit in our project, where we create the Wash Fit committee in the healthcare facility setting before starting Wash Fit assessment. So through our meeting and the negotiation, the authorities agreed to put cleaner in this committee. So actually, when we do the Wash Fit, we established a Wash Fit team in the healthcare facility who particularly look after this wash activities in the healthcare facility. So we have been successful to negotiate with the authorities, with the municipality, with the health facility committee to put cleaner in this committee. So now they are one of the key member of Wash Fit team. Out of 5, actually, there is a 5-member committee, Wash Fit team. So they are the cleaner are one of them. So in terms of some challenges that we have faced so far from our intervention in washing healthcare facility, basically one of the challenges, as other colleague also mentioned, that lack of acknowledgement to their the cleaner contribution by the management, which we see, as a challenge in terms of this contribution recognition. Second one is there is lack of dedicated staff for cleaning in a healthcare facility, and the person assigned for the cleaning is called, like in our context, it is called support staff, and he or she is wearing different hats. Actually, the plumber, sweeper, cook, postman, like they are doing, multiple work, and they are paid very less actually, and often their work is, like the neglected. They are doing a lot of work, but they are paid very less, and the work is neglected. This is something, like the big issue is here, and also lack of supply of essential cleaning material to the cleaner. Actually, there is supply of medical equipment, but when it comes to the cleaning material, like it is neglected basically. Even in some healthcare facilities, they even don't have the gloves, that they need. So there are very less or no capacity building activities for the cleaner from the authorities. Like usually the health worker, they usually get some level of training, but the cleaner, they don't usually get the dedicated training on cleaning. And I think then also we don't have national standard for washing healthcare facility yet, though the Nepal is still, we are working on that, and TDS is also part of technical working group to finalize washing healthcare facility standard in Nepal. Hopefully, once it has been finalized, so we will have some standard, and the situation will improve actually. And some learning actually I'd like to highlight in this forum is basically so far we are targeting municipality and health facility management committee, and it is very important to make them convinced to increase the supportive environment for the cleaner, like regular supplies, capacity building activities. So if we are able to negotiate with them, if we are able to sensitize them, I think we have seen some good results so far. So I think this is one of our learning. Also, engaging cleaner in Wash Fit committee has found to be very effective for infection prevention, control in healthcare facility. This is something what we have learned from our intervention so far. And then through our advocacy and sensitization activities and regular meetings, so municipality have hired additional staff for cleaning, which we feel that like the municipality is now realizing the importance of the cleaner. So TDS, this is something what we have done so far. So there are some current and future planned around washing healthcare facility, like in Nepal. That we will TDS will be doing. So we are supporting municipality to have operation and maintenance policy that will redefine the job description of the cleaners as well. So we will support municipality to have this operation and maintenance plan, so that is lacking at the moment, and where there will be mandatory provision for the capacity building activities for the cleaner as well. And we'll continue to highlight our like importance of work that cleaner are doing in healthcare facility setting. And also we're also exploring opportunity for private sector participation in operation and maintenance of wash services. So possibly we will have new projects soon if the funding is secured on that. So this is something, like the synopsis of what we have been doing in Nepal, and what we have like based on our experience and experiences, and also some future plan. Thank you very much.
Thank you so much, Prakash, and really exciting to hear, particularly about some of the successes you've seen, like engaging with wash cleaners and wash fit. I think that's an important role, and certainly if they're one of 5 members, they have a voice to be heard there. I want to thank all of our speakers. I apologize, we're a few minutes over time here, but thank you to our speakers from the hospital, Kamuzu Hospital in Malawi, to the cleaners. We thank you for all of your work and for being with us today. I know you're very busy cleaning, so thank you for taking the time. And thank you to Wendy, Lauren, Prakash, and Francois. I am going to leave the room open. I apologize we didn't have a chance to have as much discussion amongst colleagues as I had hoped, but I'll leave the room open if anyone wants to chat and say anything. Please take a look at the list of resources. And lastly, I realize our geographic diversity today did not include Latin America or the Caribbean. So if you are doing work, well, I guess, Lauren, you mentioned Haiti a bit, but if you're doing work in Latin America and the Caribbean and like to share, please let us know. We'd love to make sure we cover that. Thank you all again. And like I said, we'll leave the room open if you want to say anything. Turn on your mic and chat.
Hi, everyone. This is Julia Sherry with Water Mission. I have a quick question for Lauren. Lauren, you talked about, I love the idea of the stand-up comedians to train cleaners. Obviously, behavior change is such a tricky thing. And so you'd mentioned social art methodology. I'm not familiar with that. And I wondered if you could just give a quick background to what that methodology is.
Sure. Thank you for asking the question. So social art for behavior change is something that One Drop has been, I would like to say, pioneering in a sense. We've been practicing it for many years and refining it through behavior change science over time. The premise and the idea behind it is really about designing from a participatory approach, so socially for everybody, social art, and it's working with arts, recognizing that art is very much speaks to everybody and anyone. We try to identify local arts within the region and local folklore as well, recognizing that that's what people can identify with, and working with local artists. So a lot of it is capacity building of artists as well, to be able to address social issues. So art for social change and social issues. But the whole strategy that gets built behind it is through a behavior change approach using various models. So yeah, when I gave the 2 examples, we don't just, for example, like in Malawi with the comedy sketch group, they don't just receive the contract to go and write the script and go out and deliver it throughout various healthcare facilities. It's really a participatory approach that we encourage. So they go and they co-design the script with the priority groups. So in this case, it is the cleaners and user groups, which are, I think they're still trying to work on identifying. So the idea being that going through that participatory experience over time will not only spark and evoke emotion, but ultimately will result in change.
Great, thank you so much. That's really helpful.
Yeah, I put our website up, so feel free to check that out, because there's some examples of social art for behavior change activities that we apply in our 14 projects worldwide.
Thanks, Lauren. Does anybody else have any other questions? I know, Lauren, I just saw that you need to leave, so she did post her email in the chat, so if anyone has any further questions for any of the speakers, I think Wendy Graham also left her email, and I have both other participants' emails as well if we need to reach out to them as well. But if there aren't any other questions, or if there are, we'll have time to address them. I'll just leave it open for a little bit. Thanks, Lauren. All right, well, it sounds like that's all. So thank everyone for joining. Great discussion, and I hope you guys have a great rest of your day. Happy Thank Your Cleaner Day.